If you're having symptoms of chest pain, it's sometimes difficult to tell whether the chest pain is from a heart attack or from some other condition like indigestion. Most people don't clutch their chest and fall over when they have a heart attack. Sometimes it can be a slowly growing pain which becomes very intense after a few minutes. Some of the other symptoms of a heart attack include radiation of the pain to one or both arms, to the neck or jaw, or to the back. Other symptoms include shortness of breath or nausea. If you're not having these symptoms, however, you still may be having a heart attack. If you're having any doubts, you should seek medical attention promptly. I've heard many different descriptions of the chest pain that is associated with a heart attack. The most common one is chest pressure, a feeling of a tight band or the feeling of an elephant sitting on my chest. Other symptoms people describe are sharp or a burning sensation.
Doctor, what if I just take an antacid and it gets rid of it?
If the pain is relieved with an antacid, this could be just indigestion. However, if the pain returns or increases with exertion, then you should strongly consider seeking medical attention.
What if I'm just having shortness of breath?
Shortness of breath can indicate a heart attack, especially in patients such as diabetics who don't always have chest pain.
Doctor, what if I'm just having intense discomfort in my chest?
Often people will describe the sensation they feel as a discomfort rather than actual pain, but this still could be a heart attack.
Doctor, if I'm having intense chest pain, how long should I wait?
If you're experiencing intense chest pain symptoms for more than 5 minutes, you should call 911. In the emergency room, they're likely going to do an EKG or an electrocardiogram. They'll also run some blood tests to see if you might be having a heart attack. And the doctor there will take a detailed history and do a physical examination. Typically, after reviewing the EKG and the blood tests, the doctor will have a good idea whether you're having a heart attack or not. However, there are some people who need further observation.
What would you say to people who feel they don't want to needlessly bother the physicians?
A lot of patients are in denial about their symptoms and they avoid getting care for that reason. But with heart attacks, seeking care promptly is very, very important, as once that heart muscle has died, it can never be recovered. If you have any doubts about whether this represents a heart attack, you should err on the side of caution and get medical attention.